for at least 2 more weeks. And we are under a different set of circumstances as legislators in trying to really take action and get something moving in this legislative session. We asked for a bipartisan work group that would include Democrats and Republicans from both chambers, as well as the governor's staff, and the governor rejected that idea. So we are going to just continue working to try and make sure 150,000 Iowans have health insurance.
Well, I think we felt passionately about the issue. That's why we asked for the meeting, and still think that we're going to continue to move on this because it's important to those 150,000 Iowans.
Did the governor tell you it wouldn't be 2 weeks? Because in the committee today, there was an indication that it was
He told us,
tomorrow.
we pressed him on that issue, and he did say it would be at least 2 more weeks.
The other thing that we really found out is that the governor and his people have a lot of work to do. They have a vague concept of what they want, but in our conversation with them, they were unable to answer some questions, pretty basic to how we develop a program, how to work with the feds, and how to deliver a new healthcare system to the state of Iowa. So we are hoping that they will get engaged with us. We're going to focus now on working with our colleagues in the Senate, Republicans and Democrats. We have, of course, as Senator Yoakum said, we have a schedule and time limitations because of our funnel, and we have to keep this thing moving. We are also going to start working with our House colleagues because we want them to know that they're welcome in developing something. We think that the governor is going to work out something, but he won't share that with us until he has it. He's weeks away from doing something, and we want this time to be productive with our legislative colleagues.
Did he indicate how many additional Iowans would be covered by whatever he's developing? I mean, is that part of the target, or
Details really weren't
The details were
not discussed.
And we even tried to get an idea of financing, how he would finance his plan, and those details were unknown as well. So we really didn't get a good sense of where the governor's plan is yet. All we know is it's going to be 2 more weeks at least.
So was the meeting that you had then with him just a lot of you guys talking to him and him saying no? Or how would you characterize the discussion?
I characterize it as educational, that we kind of had to figure out where each of the two groups were. We told them that we amended our bill today that included a lot of the programs that he had spoken about: prevention, personal responsibility, paying with outcomes. All of that is included in our bill. He was a little surprised and said that he liked that and that there may be some things in our bill that he could incorporate. And then we told him that we had a time limit that we had to work on, and he was, I guess you could say he was appreciative of the time schedule, but he was really not willing to open up his office or his people to discuss about this immediately. He wants time to think about it, and he's got a lot to think about. He doesn't know how he's going to finance it. He doesn't know what benefit plans he has. He doesn't know about the federal requirements that we need to get something passed. So he's got a lot of work to do.
I think it's the first step, and we've got an opportunity to move forward in the Senate. And while he's developing his plan, we're still looking out for the 150,000 Iowans that are in need of health care.
What's to make people who want this Medicaid expansion to happen, particularly some of these 150,000 people that would be added to the rolls, what's to give them any hope or indication that this will actually happen? Isn't this kind of false hope because the governor so far is not on board with this?
There are 8 Republican governors in the past 4 weeks who had the same position as the governor of this state who have changed their mind. And we're hoping that they will begin to understand the financial impact to the state and the opportunity to bring more people under health care insurance than ever before. And then I think you have to know that the Democrats in the Senate are uniformly in agreement that we will have a plan. We have to have a plan, or Iowa Care expires at the end of this year, and we're not going to leave this place until we resolve this issue. And we are hoping that we resolve it in a way that more Iowans get covered for for far less than what we have now and for better care.
Is this year June 30th or December 31st?
I think that's going to be dependent on really how the governor how much he wants to work with us, because we are anxious to work with him. But if it's going to be 2 or 3 weeks before we see his plan, we have funnel dates that we have to meet. There's going to be, like you said, Mike, there's going to be a lot of anxious people who want to know if this is false hope. And the only thing we can say is there's a commitment on the side of the Senate Democrats to push this until the end.
There are other advocacy groups out there. I mean, we've seen a lot of those folks come into the Capitol and talking about how that impacts, people in Iowa. And not to say that those other governors aren't important, but I think Iowans listen to Iowans, and they are advocating for health care for people that they know are in